Today, we are breaking down one of the biggest Medicare Advantage developments for 2027, the Advance Rate Notice. And this is more than just a routine CMS update. It is a clear warning signal to healthcare leaders about where Medicare Advantage is heading: increased focus on value-based care, stricter payment models, and more pressure to operate with precision. The headline number is what gets everyone's attention. CMS is proposing just a 0.09% net average payment increase. When you compare it to prior proposal cycles, CMS projected 3.70% for 2025 and 4.33% for 2026. So, this year's proposal stands out immediately, as that kind of update signals a more demanding environment with less cushion for inefficiency, weak execution, and margin loss. And if you look under the surface, you can see why this feels tight. CMS shows a 4.97% effective growth rate, but that is mostly offset by a negative 3.32% from risk model revision and normalization and minus 1.53% from sources of diagnoses. In other words, the math is being pulled down by the payment methodology itself, not just by one simple rate change. The core changes start with risk adjustment and clinical documentation. CMS plans to keep the V28 HCC model but update it with newer data, shifting from 2018 diagnoses and 2019 costs to 2023 diagnoses and 2024 costs. Watch our other videos to learn more about these models. CMS also intends to exclude diagnoses from audio-only visits and unlinked chart reviews from risk score calculations. Simply put, CMS aims for payment-related diagnoses to be more clearly connected to actual patient care and easier to justify. For operations, it means weak point-of-care documentation can create more rework later. For finance, this means tighter assumptions, greater pressure to protect revenue, and less ability to rely on retrospective cleanup as a fallback strategy. And for value-based care leaders, it means documentation, analytics, provider workflow, and financial strategy have to work together much more closely. This reinforces CMS's broader direction of making Medicare Advantage more disciplined, more accountable, and more closely tied to real care delivery. The top organizations will be those that plan ahead and educate their teams on these changes, not those that rush after the final announcement. CMS has announced that the final 2027 rate announcement will be released by April 6, 2026. Once it is finalized, we'll put out another video breaking down what changed and what healthcare leaders need to do next. If this was helpful, follow WealthCare Inc., the business of healthcare, for more insights on Medicare Advantage, risk adjustment, value-based care, and healthcare leadership.